Just the words emergency department can be enough to strike fear into anyone who needs medical treatment. Not a week goes by without more reports of ambulances ramping and hospitals swamped, patients spending hour after hour waiting. On a Friday afternoon in Ballarat in regional Victoria, when Janessa Badley wasn't feeling well, she couldn't get a GP appointment and wanted to avoid the ED.
Just here for some abdomen pain.
Oh, okay. When did that come on?
This isn't a hospital and it isn't a GP's office. Instead, it's somewhere in between, a Medicare urgent care clinic designed to relieve the pressure on overcrowded emergency departments.
Just like to have a seat in the waiting room. We'll get to you as soon as we can.
To save the hours of wait when you're trying to feed a baby and look after a baby whilst you're not feeling the best just wasn't an option, whereas this is much quicker, much simpler, get some answers and then know whether or not you actually need to be seen at a much higher care centre.
So he's got the fracture through here.
Across the country, thousands of patients are being seen every day in these urgent care clinics.
So the bone will get end to end together, so there will be nice healing.
They are open late, often till 10 at night, and on weekends, and they're bulk billed.
This is a new model of care for Australia. It's very common in other countries to which we'd usually compare ourselves. It's very deeply entrenched, for example, over in New Zealand, that has really significantly lower presentations to their hospital EDs.
Come on in, Ken, come through.
The Royal Australian College of General Practitioners says urgent care clinics are simply doubling up on what they already do.
So these urgent care centres were designed to take the pressure off our emergency departments. But what they're doing is also, if you like, duplicating the services that we've already got, which exists in general practice.
Medicare urgent care clinics were a campaign promise from Labor in the 2022 federal election. The government has committed $720 million to open and run 75 clinics across the country. Another 12 clinics are scheduled to open by the end of the year.
If we funded general practice to the tune of what we're doing urgent care centres, we'd be able to increase that capacity and see people on the day. And continuity of care, seeing a regular GP, we've already got the foundations of the healthcare system. It just needs to be funded and expanded on.
The latest quarterly data from the 3 biggest states shows that overall emergency department presentations have continued to go up since the clinics opened. But the number of less serious cases presenting to EDs have declined or plateaued.
I don't expect that suddenly hospital ED presentations are going to start reducing in Australia. There are a whole range of reasons why people are going to hospital. We're getting older, there's more chronic disease. We know from clinicians that there's still a lot of deferred acuity in the system because of COVID, when people weren't getting the care that they needed for other non-COVID conditions. So pressure is going to remain in hospitals for some time.
On the ground in Ballarat, clinic staff believe they have helped reduce visits to the ED, although in Janessa's case, she was referred to the emergency department.
We are heading to emergency now that we have a rough idea of what's going on, so we can head to emergency, and I feel better not wasting everyone's time if it wasn't something that needed to be there.
These are designed to take the pressure off emergency departments. That's a big part of it. In your opinion, is that working here?
Yeah, absolutely. I mean, as we're seeing about 50 a day and 1,500 patients a month, and 70% of those would have otherwise presented to the emergency department, significantly changing the outcomes for patients, but also taking the pressure off what is already a very, very pressured emergency department.
But critics believe urgent clinical care is hardly good value for the money being spent.
Urgent care centres are promoted as being free, but they're not. They are so much more expensive. An episode of care, say if you've got a sore ear and you take your child, if you took your child to the GP, for just under $43. If you took your child to the urgent care centre, it would cost the taxpayer just under $300. If you took your child to the emergency centre, that's around $650. So you can see it costs the taxpayer so much more than somebody seeing their GP.
Well, I've seen some of these comparisons which compare the cost of an urgent care clinic presentation to a standard GP consultation somewhere during the usual trading hours, Monday to Friday. I just think that's the wrong comparator. As I said, a whole number of these presentations are being seen out of hours and on the weekend. And really, I think the better comparator is the cost of a non-admitted emergency department presentation, which is well over $500.
You've not seen any rash?
No, no rash.
Okay.
About a third of urgent care clinic patients are treated after 5 p.m. on weekdays or after midday on the weekend. One of the biggest challenges the clinics face is awareness. Michelle Ruane was visiting Perth and had already used the urgent care clinic in her hometown, Bunbury.
Honestly, compared to ED, it is so much better because you're able to actually see someone before the 4-hour mark.
On this day, her daughter's diagnosis is a virus. She gets medicine and symptoms to look for if things get more serious.
It's great because then it's just something minor and you're not wasting resources for hospitals when they could be doing something a bit more urgent with other people. So, and it's easier in the sense that I don't have to wait days for a doctor's appointment.
The government hopes more people will follow her lead when they can't see a GP. Choose the urgent care clinic and not the emergency department.